This week's Cardiology Countdown starts at the number 3 spot with a study of Marfan syndrome. Patients at a clinic in France, over 600 patients, were followed for 6.5 years, and their risk of aortic rupture or death was followed and determined on the basis of aortic imaging done every 2 years at that clinic. They found that the event rate was very low, 0.09% per year for those who had aortic size of 40 millimeters or less. For 45 to 49, it was 0.3% per year, but then was 4 times higher, 1.33% per year, for those who got above 50 millimeters. And that actually was at the cut point that they recommend surgery. And so their findings, they thought, validate that as a cut point to recommend prophylactic surgery. At the number 2 spot is a study done from Germany, the Lipsia NSTEMI, that looked at an immediate invasive strategy as compared with an early invasive the next day or a selectively invasive study. This was a modest-sized study, just 200 patients per arm, that looked at the size of the infarct to see whether an immediate invasive strategy done on average 1 hour post-randomization would decrease the size of the evolving NSTEMI. And what they found was it did not. They could not find any difference in the size of the infarct, and so that may be good news for interventionalists that one generally comes in early, within 24 to 48 hours, but one would not need to come in immediately. And at the number 1 spot is a very interesting study that looked at the risk of GI bleeding when using a proton pump inhibitor as opposed to an H2 blocker. This was a randomized trial of about 300 patients with acute coronary syndromes who've gotten aspirin and clopidogrel, many of them stented, some had gotten thrombolytics and enoxaparin, and randomized generally lower GI risk patients. So if you had a history of GI bleeding, etc., they were excluded. And they found a highly significant and very large reduction in the risk of GI bleeding or GI complicated ulcer with the proton pump inhibitor esomeprazole as compared to famotidine. This was about a 6 to 1% event rate over a 1-year follow-up period. And so I think very interesting data showing the big GI benefit of proton pump inhibition in the ACS patients that we see. So for this week's Cardiology Countdown, I'm Chris Cannon.